to WGSN-DB, Going Solo Network. This is a Senior Citizens Forum, and I'm Janice Wood. The Senior Citizens Forum is being sponsored by Benefits for You Too Insurance Services, where we specialize in health insurance and senior citizens health insurance plans, and also people with special disabilities that qualify for those plans. But today we're here to talk with Dr. Henry Kim.
Hello.
And we're going to talk about why dental health is so important for your body. I know a lot of people that don't like to go to the dentist, but your mouth, when you smile, it says who you are.
Yes,
right?
It does.
And also, your mouth, what's going on in it, by the bacteria in your mouth,
Right.
right? Okay,
Right.
will affect your health.
Overall health, yes.
Overall. So it doesn't matter if you're a senior citizen or you're starting out with your first set of teeth as an infant.
Right.
Those teeth are so very important. So Dr. Kim and I have known each other about seven
Yes.
years,
Yeah.
8 years.
So,
I don't go to Dr. Kim because I don't live in this area.
Right.
But
That's
we
okay.
have a lot of mutual friends
Sure.
that come to see Dr. Kim, and they all talk about him with such high regards.
Thank you.
And every time I do research, I find out what an accomplished person Dr. Kim is. Yeah.
Yes,
Okay.
thank
I'm going to tell you what I know about you.
Okay.
I know that you went to Harvard University,
you. You're right.
dentistry school,
Yeah, dental school, sure.
dental school, and when he was through as a student, he became the teacher.
I was there for a short period of time, and then I taught at NYU for a little bit. Yeah.
At NYU. And I also know that you go to Korea
Yes.
and
help out. Actually, I have a. Well, can I introduce myself?
yes, you can, of course.
Hi, my name is Henry Kim. I'm a dentist here in Mission Viejo, California. And by trade, I'm a prosthodontist. That is a dentist who specializes in restorations or dental restorations, including implants, dentures, bridges, any dental restorations. That's my specialty. But of course, my office will handle all kinds of patients, from simple cleaning to all the complicated dental patients. That's who I am, and yes, and I have known Janice for many years.
Yeah.
Since I moved to California, and I'm glad that I have met her, and since then she's been very helpful, teaching me all these things about Medicare insurance.
Yeah.
And then and I have been learning quite a bit from Janice about now that the Medicare is switching their dental plan to.
Well, it's not Medicare, okay?
Okay.
So I've got to explain it. It's not Medicare. If you have a Medicare Advantage plan or you have a Medicare supplemental plan, some of them will offer some dental insurance that
Yes.
goes with it. If you have just original Medicare, you don't. That's not off. That they don't offer any dental, but it's your Medicare Advantage plan. So depending upon what area you're in. Now, some of you may know Dr. Kim because Dr. Kim practiced in Florida for a while. Is that
Yes,
correct?
I practiced in a town called Palm Beach Gardens, or actually North Palm Beach, right next to Palm Beach Gardens. And I was there for about 6 years, right off US 1 highway. And it's been a wonderful time in Florida, but I decided to move out to California, where I guess sun's a little bit shinier than Florida.
Oh, well, don't tell that. I know a lot of people from Florida. They don't want to hear you
No.
say that. Say that.
Yeah.
Okay.
Yeah.
So, but you've had a lot of years of experience.
Sure.
And I know you go on missionary work and you help
Yes.
people with your
Yes.
when you go out on your missionary work,
Right.
and you do that.
Yeah.
So I just think that's a really great thing that you're
Thank
giving
you.
back to the world, because if you're going, I know you go into different countries to do that.
Yes.
So that's just a very positive thing for me, because dental health is so important.
Sure.
Because in another lifetime, long ago, I was a dental assistant.
Yeah.
And things have changed since I was a dental assistant.
Yeah.
And if you're afraid to go to the dentist, I remember, you know, people would come in and they would just shake at the thought of going to the dentist.
Yes.
Okay.
Yeah.
And
A lot of patients
Things are-
have dental phobia. That is a fear of going to dentist. I think a lot of that has to do with their youth, past experiences in their youth. When they are little kids, they go to the dentist and their experience wasn't very pleasant.
Positive.
Yeah, positive. So
yeah.
you know that kind of lingers in their mind,
Mhm.
and that certainly affects their later dental treatments, or that's what triggers the fear of the dental treatments in their
Yeah.
later lives. But there are a lot of things that the patients can do or dentists can do to lessen the fear. One thing we can do is give them sedatives to calm their nerves, so that when they come to dentist, so they will be more relaxed. Now we have also a lot of the dental anesthesiologists that are out there who can help us with patients who are fearful of coming to dentists, so that we can actually put those patients in more of IV sedations, so that they'll be completely out while they're getting their dental treatments.
Yeah, because I know it just so much has changed
Yes.
from when I did that. I mean, even there's things that you don't have to have those silver. I call them amalgam, which I
Right.
know is like a silver filling.
Yeah.
You do other things now that make the tooth look so much better.
Yeah. So we don't use silver fillings not anymore. We're using a lot of the tooth color restorations called composite or resin. So the final result will be more aesthetic and more pleasant to look at, and it.
Okay. So it's going to
Better for
look
the
more like
patient.
your tooth.
Yes, of course, because it has the same similar color as your own tooth, so that it's certainly going to look better.
Yeah.
Yeah.
Definitely. Because every once in a while you'll see somebody they'll open up their mouth and you see all those silver fillings and all
Right,
the
right.
gold
Right.
and the
So nowadays we're trying to go metal-free dentistry. That is to say, we don't use a lot of metal products for our dental restorations. We used to have what we call PFM, porcelain fused to metal crowns.
Mhm.
Those are replaced by zirconia and zirconia fused to, or porcelain fused to zirconia crowns. And as we just said, a lot of the silver fillings are because we have more and better products such as composites and resin, tooth color and film materials, that we can make the tooth look much better than with the silver fillings.
So if I want to start with basic dentistry,
Yeah.
okay, and that's like, I've always gone to the dentist about every 6 months,
Sure.
okay,
Yeah.
just to get my teeth cleaned,
Right.
okay. How important is that to have done?
Well, let me answer it this way. Nowadays, even the dental insurances or the insurance plans have recognized that the regular checkup and cleaning is more important than actually doing the dental treatments, because the prevention of these dental disease or oral disease is more important than actually treating them. So the insurance has changed their plans so that instead of every 6 months, patients can actually come in every 3 to 4 months, so that we increase the frequency of cleaning. So that will allow the earlier detection of any dental decays or dental disease, but also simply having the more maintenance visits will reduce the chance of any of the dental disease or dental decays.
Because this is a question, if I'm taking a lot of medication,
Yeah.
that can reduce the saliva in my mouth?
Sure. Some of the
Which-
medication for your heart conditions, like diuretics, you can actually slow the salivary flow in the mouth, so you actually end up with a dry mouth that can allow more bacterial growth in your mouth. And yes, some of the bacteria is good for your mouth, but also there are a lot of bad bacteria that are in the mouth that can cause gum disease and dental decays. So when there's less salivary flow, you don't wash those bad bacteria out. So having those medication in your system can certainly reduce the salivary flow, and in turn increases the risk of dental or oral disease in the mouth. Yeah.
Well, so my question now is, can oral disease affect the rest of your body?
Sure, because it affects not only your heart condition but your overall health. We know that some of the bacteria that's in the mouth can actually end up in your heart through the bloodstreams from your mouth to the heart and cause something called endocarditis. That's a serious disease. So certainly you want to have a healthy, clean mouth so that you can certainly prevent a disease like that. But also the bacteria in your mouth can travel anywhere in your body to end up harboring, and that can certainly cause certain other types of the disease, or can be related to having those diseases. Yeah.
So it could affect the rest of your organs, because we
Sure.
always think about
Yeah.
the heart,
Yes.
and they think, okay, if I drink alcohol, it may affect my liver.
Yeah.
But the same thing for that bacteria is going to
Sure.
go into those other
Right.
organs in your body.
Yeah, so that's why having a clean, healthy mouth can affect affect your overall health. So in order to have a very healthy overall health, you're gonna have to have healthy oral health or clean oral conditions.
Right. It's just so important. So you recommend anywhere from 3 to 6 months to come in and see?
Yeah. So for the regular recall visits, that is for checkup and cleaning, you want to come in every 3 to 4 months minimum. Now 6 months may be too far apart. And you certainly want to also take good care of your teeth at home, and that is to say you're going to have to brush your teeth and floss your teeth regularly. That's the cliche from the dentist, right?
Right.
But nowadays we also recommend that you have a water pick in your armamento for taking good care of your teeth at home. Water pick certainly has proved to flush out any food or plaque that's built up in between teeth, better than just simply using floss or what we call the interproximal brush. So we recommend.
So the interproximal, I know because of my background, that
Yeah.
means it's in between
Yeah,
the
so
teeth.
yeah, so it's a small toothpick with a bristle at the tip, so
Yeah,
that you
I
can
love
go in
those.
between teeth to clean the
Yeah.
space in between teeth.
Feels good.
Yes. So not only do you need to brush, but you need to floss. Maybe use those little mini toothpicks with bristles at the end, and then at the end use the water pick to flush out the debris or whatever the buildup you have in between teeth.
Now, I notice as I'm getting older,
Yeah.
food gets caught more in my teeth than
Right.
it did even a year ago.
Yeah, and that's pretty normal because over the years, you probably had to deal with a chronic gum disease, and that slowly causes a recession of the gum and the bone, and so in between teeth you will have more space as the gum and bone recedes, and because of the space, you're gonna have more food. So that means you're
Because
gonna.
I'm having bone loss, right?
So yeah,
That
so
would cause some of that.
yeah, so periodontitis is an oral disease where you have recession of the bacteria causing the disease to cause the recession of the bone and the gum. So then, as that condition continues, you're going to continue to have a bone loss and gum loss, and thus increase the space in between teeth.
Yeah.
And thus you will have more food getting in between.
And I know, because I'm really good about brushing my teeth several times a day,
Right.
that if for some reason I miss, all of a sudden it doesn't feel right in my mouth.
Right.
It hurts, or there's more bleeding.
Right. So if you don't brush properly and get rid of the debris in between teeth, what will happen is you will have what we call the gingivitis, inflammation of the gum. Right.
Yeah.
So because of the food or plaque that's built up in between teeth, you're gonna have rush of blood getting into the gum, and it will start to balloon up, and that pressure will cause the ache. We normally say it's a throbbing ache. All right. So if you have something like that, it means that you have a swollen gum. Certainly you want to brush and floss to reduce the inflammation or get rid of the plaque or food so that you can reduce the inflammation. But
So now I'm going to ask you a very basic question.
Yeah.
Okay. Is there a right way to brush your teeth?
yeah, certainly there's a right way to brush, of course. A lot of patients, they just scrub their teeth back and forth, but that's sometimes more detrimental to the teeth than not, because they just scrub and scrub, and not realizing they're actually brushing their enamel away. If you're brushing too vigorously or too hard against the teeth, you press the toothbrush against your teeth too hard, that can cause what we call the toothbrush abrasion, and that means that you're gonna abrade the enamel away from your tooth. So you want to just use a gentle circular motion of the toothbrush around the gum line to allow the bristles to kind of flicker the plaque off the teeth, off the surface of your teeth, rather than scrubbing the side of the tooth so that you cause the abrasion.
Right. So I know with children,
Yeah.
the child, we think about, when you brush your teeth, you're brushing the front of your
Yeah.
teeth. So you got to remember to get those back there.
Yeah.
And the brushing of the tongue is really important.
Yeah, so tongue, you will also collect some plaque and bacteria, so you certainly want to get rid of that so that you can have a less chance of having bad breath sometimes. But also for your teeth, you want to make sure you brush all your teeth and every surface that you can get to with your toothbrush. I always tell my patients to kind of run their tongue through each tooth after brushing to see if there's anything that you have left on that tooth, on a tooth. Then you can always go back and brush that tooth again if you find that there's still some rough or if the tooth is not smooth to your tongue.
Well, I do this crazy thing.
What do you
I have
do?
one of these mirrors that is like 15 times, and I look at my teeth after I brush them, and I want to see what I missed.
Yeah.
And I do. I miss stuff. I find the stuff right along the gum line.
Sure.
And I'll go back in.
Yeah.
And I'll take it out with either a pick or those little brushes, or go back and rebrush them.
Yeah. Sometimes plaque is sort of white in color, so
Yeah.
you can't really tell whether you still
Right.
left the plaque on the tooth or not. But just running your tongue through each tooth, you can tell if the surface is smooth or not. If
Right.
it's not smooth, most likely you left
Right.
some plaque on it, and you just have to brush it again.
And some foods leave more stuff on your teeth than other foods.
Yeah, more stringy food will get in between your
Right.
teeth, and it's hard to get rid of. On Mondays, we normally see a lot of patients coming in with the gum ache sometimes,
Right.
and that's because they had gone to movie and had some popcorn, and they had the husk of the kernel still left in between teeth.
Oh yeah.
And sometimes they can't really eat, it's not too easy. It's difficult to remove those things even with brushing. So yeah, so make sure you remove all the food particles that you might have accumulated over your teeth.
So do you recommend any special type of a toothbrush? I mean,
nowadays we do have electric rotary toothbrushes that are out there. Most of them are good. We also have something called Sonicare that's more of a toothbrush that vibrates to remove the plaque off the teeth. But whatever you use, just follow the same the advice that I just gave you before. Make sure you're not pressing those toothbrushes against your teeth too hard. Let the bristles, the rotating head or the vibrating bristles work on your teeth to just simply to remove the plaque rather than scrubbing your teeth so hard. Yeah.
and we were talking before we started doing this, okay? Just real quick, we have to hear from our sponsors, so we're gonna take a little quick break. This is WGSN-DB going solo, and we'll be back in just a moment. Hi everyone, this is a Senior Citizens Forum on WGSN-DB going solo, and I'm back here with Dr. Henry Kim, and we're talking about why those teeth in your mouth are so important to your body and to your health. And we were talking about toothbrushes a few minutes ago. We're going to start back on right there with toothbrushes and what to be looking for, and we'll go into a couple of other little subjects, okay? And because one of the things that I just know from how important it is that you take care of your mouth, because by taking care of your mouth, it's going to help take care of the rest of your body.
Right.
And that doesn't matter if you're 9 months old and you're just getting your first teeth, or you're in your 80s and 90s. Those teeth are really important to your health.
Right.
Or oral health.
Sure.
So we're gonna go back to the toothbrush.
Okay.
Okay.
Right. Yeah, toothbrushes are well. Teeth are important because it's part of your overall digestive system. Because if you're not able to properly chew your food, you're not going to be able to digest your food properly. So
Right.
the whole digestive system starts with your teeth. You're gonna well, at least with your mouth.
Right.
So taking care of your teeth is very important because you want to keep your teeth for a long time,
Right.
so that you can eat well and live well for a long
Right.
time.
So I'm going to go back to that in a second, but let's finish up with the toothbrush.
Oh, toothbrush, sure.
Okay, yeah, with the toothbrush. So there's all different types of toothbrushes out there.
Right.
So when you go into the store, maybe
Yeah.
the grocery store,
Right.
or you're ordering online, you see a variety of toothbrushes, soft toothbrushes, hard toothbrushes, different types of the little brushes that you
Right.
put in between.
Right.
But the regular toothbrush that you use, twice a day, or I know some people who
Right.
brush more than
Right.
twice a day,
Yeah.
and some people who don't brush their teeth, okay?
Right.
But it's important to brush those teeth,
Right.
because if not, you're gonna have gum disease,
Right.
okay? So, but how long do you keep a toothbrush? Okay.
Well, let me kind of answer by saying how important it is to pick out the right toothbrush.
Right.
Yeah, so when you go to the store, you want to probably pick out a toothbrush that is right size for you. There are different sizes, normally for pediatric size and then
Right.
adult size. So if you're an adult, most likely you want to pick out an adult toothbrush. Second thing you want to look for is that you want to pick out bristles that are soft, because as I said before, if you're scrubbing your teeth hard, then you can cause abrasion. But if you're using hard bristle toothbrushes, that process could be a lot more. It could take you could abrade your tooth away a lot faster than you can with the soft bristles. Okay, so you want to make sure you pick out the soft bristles. Then there are different types of toothbrushes that are out there. You can just pick out one of those conventional toothbrushes that are manual, used by your hand, or you could buy one of those electric toothbrushes with the rotary toothbrushes. The rotary toothbrushes, you want to use it correctly by not pressing the bristle heads against your tooth so hard that the bristles are bending against your tooth. You want to have just the tip of the toothbrush as it rotates. Pick out the plaque off from the tooth surfaces. If you're using Sonicare, same way. If the Sonicare toothbrush head, it vibrates, and you want the vibrating bristles to just kind of scratch or tickle the tooth surface to remove the plaque, rather than you pressing against the tooth to feel the back of the toothbrush against the tooth. Then that will be you brushing too hard. So those are the little tips about toothbrushes. How often you should change those toothbrushes. Well, if you start to see that the bristles are bending, that's probably when you need to change your toothbrushes. So if you go to your the bathroom today and then see that you have a toothbrush with the bristles that are all bent and flat, it's time for you to have
sometimes they look like they're all spread out.
Yes. So that's when you need to change your toothbrush.
Or
every 3 months will be a perfect time for changing toothbrush.
And I always look at it when I need to start a new tube of toothpaste.
Right.
I change my toothbrush at the same time.
Yeah, it's fun, right? Yeah.
So that way you don't have to think about oh, I'm out of toothpaste. It's time to change the whole thing.
Yeah, I guess you could go through a tube of toothpaste about 3 months there.
It's about So to me that's a good guide, because I always see toothbrushes don't always look so good after a while.
Well, yeah, if you want to change your toothbrush more often than not,
Now, I used to work with a gentleman years ago. Every time he got sick, he changed his toothbrush.
Yeah. Because
toothbrushes still have diseases on them.
Right. Yeah. Sometimes it's a collection of bacteria that's going to be on the toothbrush, because you're going to put it in your mouth to brush, even though some of the bacteria will die with the fluoride or whatever the toothpaste that you use. But a lot of the bacteria will stay on the toothbrush. So it's, you can certainly find little casing with the UV lights that will actually kind of kill the bacteria from your toothbrush. And when you store them, so instead of just putting it into a cup, you can actually find one of these UV store cases.
Oh, I've never.
Yeah, yeah.
Okay.
So you can find these cases with the UV lights to desanitize or sanitize your toothbrush.
Yeah, because I think it's important, because if you're sick,
Yeah.
you're just putting the germs right back in if you go in and brush your teeth while you're sick.
Yeah, you certainly don't want to have a toothbrush that's filled with the bacteria.
Right.
Right.
And can bacteria just form on your toothbrush?
Well, I think with the running water and toothpaste, most likely that there'll be a minimal amount of bacteria, but and as it dries up, the bacteria will not stay on your toothbrush so much. But certainly don't want to use an old toothbrush with that.
Yeah.
You know.
So I like your recommendation.
Yeah.
every 3 months. That's a
Yeah.
good standard to use.
Every 3 months will be probably a good standard.
And that's the same thing if you're using an electric toothbrush.
Yes. Same thing with the electric toothbrush. And nowadays these electric toothbrushes or Sonicare toothbrushes will have a replacement a brush head that you can purchase
Okay.
at your dental office or even at local drugstores.
Okay.
Yeah.
All right. So you mentioned before you get 2 sets of teeth.
Yeah.
Naturally.
Naturally, you have two
Yeah.
sets of teeth, of course. Yeah.
Yeah.
As a baby, you will end up with 20 teeth, 10 on the upper, 10 on the lower. And as you start to age, probably starting at the age of 6, you start to have a replacement teeth.
Okay.
And for adults, most likely you'll end up with 32 teeth, 16 on the upper, 16 on the lower. But 4 of those teeth are wisdom teeth. They're the last molars on each 4 corners of your mouth. Sometimes they do not erupt fully and end up needing to they end up needing to be extracted because it may cause some other health issues.
Yeah. I know last week my grandson had 4 wisdom teeth pulled at the same time,
Yeah,
and I'm
yeah.
like, well, that's a lot.
Yeah.
But from way back when,
Right.
okay,
Yeah.
that was a lot. Now he was back in school the very next day.
Well, nowadays, I think we have a better understanding of how to extract these teeth, and some patients are put under so that they will have a less traumatic experience.
Okay.
And with that, the dentist will have a easier time extracting wisdom teeth. Just this morning, I had a patient who came in with what we call the operculum. Operculum basically means a tissue or gum grown over the wisdom tooth, and because it was over the wisdom tooth and food was getting underneath, there was a lot of inflammation, and whenever the patient was eating, he was chewing on that swollen gum or inflamed gum, and he was in a lot of pain. And in a case like that, yeah, we certainly want to take those wisdom teeth out so that he won't have those inflamed gum and pain that he has to incur with the chewing food.
Because I remember, I'm talking a long time ago, my wisdom teeth were growing
Yes.
like this.
Sideways, it comes out sideways.
Well, no, yeah, they were sideways
Yeah.
and pushing into.
Yeah, tooth in front of it. Yeah.
Yes.
And whenever that happens, there's a higher chance that the tooth in front of it, of that wisdom tooth, will catch a lot of food in between those, in the space between those 2 teeth, and end up with the decay. Now you end up with a decay on a tooth that you really need to keep. So that's why it's sometimes recommended to have those wisdom teeth taken out, even though it's coming out sideways and maybe difficult to extract. But it's better for the overall oral health to keep the tooth that you want to keep, and then take out the wisdom tooth and reduce the chance of any food getting in between the wisdom tooth and the tooth in front of it.
So, as a senior, okay, I remember when. Well, I'm going to go back. I remember when I had all those little ridges on my teeth.
Yeah.
And now it's like they're flat.
Right.
From a lot of use.
Yes. Yeah. We call the attrition. With anything, a lot of things that are in our body are wearing down, and that's part of the wearing down part that we have. So when teeth get flat, sometimes we lose enamel on top of our teeth, and we end up with a dentin exposed, and sometimes that may not be so painful because the nerve actually
Right.
retracts within the tooth, but certainly it's more prone to dental decay, and so you want to make sure when you have worn down teeth, you want to make sure that you get regular checkup and cleaning so that we can, a dentist can make a recommendation as to how to preserve your teeth better. Sometimes it may need crowns or fillings, depending on the situation, just to make sure that the teeth are not wearing down as much or
Okay.
not as
Or you
fast.
can use a resin so you don't
Yes.
can't tell.
Right. Yeah. We can use the resins or composite restoration filling materials to cover the tooth so that we can prevent further intrusion, or intrusion will be more on the restoration than your natural tooth.
Right.
Yeah.
Because I think I have some resin right here.
Yeah.
And it was like going to having my nails done. They showed all these different
Yeah.
shades
Yeah.
that
Yeah.
they were
So
matching.
if you have a lot of wear and jagged edges at the
Right.
the tip of your tooth, it's more prone. That's going to be it's going to be more prone to further chipping or further wear or
Right.
further breakdown.
So
So by having the resin to cover those jagged edges or worn down edges of the teeth, then you can preserve the tooth a little bit better and a little bit longer. You may have to do it over and over again sometimes, but it's better to just continue to have the tooth break down or break off.
okay, so that's a common thing.
Yeah, sure. With the geriatric patients, let's say they have been using those those teeth for 70, 80 years. So certainly the natural attrition will be there, and you will commonly see a lot of jagged edges or fractures of these
Yeah.
teeth. Yeah.
But there's things that you can do now that we couldn't do 50 years ago or even 10 years ago.
Well, if you're a younger patient, or let's say even if you're in your 50s and 60s, in order to, and if you're a clencher, like some of the patients are, going through a lot of, life stress, and they tend to clench and grind their teeth. So for those patients, to preserve their teeth, we can certainly make something called a night guard. They can wear over their teeth, and instead of wearing their own teeth down, they can wear this sort of a mouthpiece, or what we call the bite appliance, to prevent further attrition or breakdown or wear on your natural teeth.
I'm going to ask this question because I get this question asked at least once or twice a month.
Yeah.
I'll get someone call me up and say, does my dental insurance cover implants? Okay.
Yeah.
So more of the dental plans are starting
Sure.
to cover implants.
Mm-hmm.
They weren't, even 3 years ago, they
Right.
weren't covering implants, but I'm finding more with authorization that they're
Yeah.
covering it.
Yeah.
But when would you recommend to a patient that they would need an implant?
Well, as we said before, dental insurances are more accepting the claims on dental implants. But the dental implants are for those teeth that are, I'm sorry, let me go back. You want to, if you're missing teeth, then you're not going to be able to chew very well or eat your food very well. So then you want to have those missing teeth replaced. That's when the dental implant will be most helpful. Sometimes if you are a patient who's wearing dentures, and the dentures are not very retentive, and and in order to help the retention of the dentures, you can have dental implants and allow the denture to have some kind of attachment system put in between the implant and the denture, so that the denture will have a better retention. With a better retention, you'll be able to eat or chew your food better, and that's when you would have a dental implant. So if you are completely edentulous, meaning you have no teeth, then you can have multiple implants to replace your missing teeth, rather than having just a couple of implants to hold the denture. So there are there are a number of ways that we can use dental implants to improve your not only just your smile, to replace missing teeth or broken teeth, but we can also help patients chew better with the dental implants because they're more stable, they're more natural in a sense that they're fixed to your bone and fixed, so that unlike the dentures which is removable or movable, you'll be able to eat better with having fixed teeth with dental implants.
Because I know I talk to people who have dentures and they'll say they make me gag.
Yeah.
And they take them out of their
Right.
mouth all the
Right.
time. Yeah.
Yeah. So
That would remove that.
right. So if you have a denture that's not fitting well, certainly that can cause a gag reflex. But if you have dental implants, that's going to help you wearing the denture with more confidence because it's going to allow you to have better retention of that denture. Then certainly dental implant is something that you can have.
And those smiles are so important.
Yeah.
Yes. I just think it's really good to know what's available to you, and to know if you're afraid to go to the dentist, that there's ways to help protect you from your fears.
Yeah.
And
You mean for the smile?
for not so much for the smile, if you're just afraid to go to the dentist.
Yes, I think we mentioned something about this sedatives that we can prescribe for patients to come in with the sedatives, so that they'll be a little bit more relaxed. If the oral sedation is not something that is not enough, then we certainly have a dental anesthesiologist who can actually give you IV sedation. So the patient will certainly be aware of what's going on, but they'll be a lot more relaxed and a lot more, they will not remember much even. But they'll certainly need to have have a driver bring them in, because they will not be able to drive in and out by themselves because of the sedatives that we give, whether it be oral sedation or IV sedation. So that's something you'll have to remember. But to reduce their fears, we have a lot more ways to accommodate those patients with dental phobia.
So one of the things we want to just wrap up in a few minutes here, that is so important to make sure your dental health or your oral health is taken care of. We know that everybody that sees the show is in many different areas of the country, but please, see your dentist. It's really important because it can affect your health. If you're here in the Southern California area, Dr. Kim is in beautiful Mission Viejo, which is in Orange County, California. He would love to see you. We have the information is posted on here on how to get a hold of both me or Dr. Kim. Dr. Kim's staff is very informative. They'll help you over the phone, understand some of your insurance questions. You can also call me. One of the things a lot with dealing with health insurance plans, especially senior health insurance plans, you're going to need prior authorization. Okay, you're going to have to get that. But if you have any questions on that, please feel free to contact us. And thank you very much for being on the show today, Dr. Kim.
Thank you, Janice.
There's a lot of interesting information that you provided.
Well, thank you for listening to me.
All right. And this is WGSN-DB going solo.
Hi, I'm John Thomas. I want to share with you a professional products and services directory we call Going Solo Directory. And you need to check this out. If you want exposure to your business or are seeking professional product or services, this directory has it all. And that membership, for the many special features, you get the benefit of a worldwide exposure with a 40-minute video interview on an international business showcase. All this for just one low annual fee. For more information, contact GoingSoloDirectory.com.